Today, we learned this budget was a fiction. It's not worth the paper it's written on.
The Ontario Liberals calling this a fictional book because inside, the Ford government had promised to balance the budget by 2027. But today, Ontario's financial watchdog says their forecast missed the mark by billions of dollars. Ontarians can expect a $10.1 billion hole in the budget by 2027. That's according to Ontario's financial accountability officer, who doesn't expect the government to return to balance without reducing spending or increasing revenues. But the finance minister's office is standing firm, telling us in part, we remain on a clear path to balance by 2027-28, and adding, FAO reports reflect a moment in time and do not encompass the entirety of the province's finances. How do you respond to that?
The minister is really not being honest with the people of Ontario.
Last year, the Ford government tabled the largest spending budget in Ontario's history at $214.5 billion.
And for all of this spending, what are we getting for it? Never has a government spent so much to deliver so little. They're actually doing things like privatizing our services, and that is actually costing us more.
The Ford government has been accused of privatizing services like healthcare. Today, the Minister of Health announced more powers for pharmacists. In the past, the Ontario Medical Association has said that this funnels money away from the public system and into private pharmacies. Under the government's changes, pharmacists would be given the power to assess and prescribe for 14 additional ailments, like sore throats, shingles, mild headaches, and lice. The government's also looking to grant more powers to psychologists, physiotherapists, and optometrists for things like minor surgical procedures in the office.
We're essentially wondering, why is it that the government is also trying to remove physicians from part of the patient care?
So it sounds like you're concerned about some risk to patients with the government doing this.
Absolutely. There's a lot of risks. Surgery is not a minor thing. We're talking about cataracts, talking about, eye surgery. You want access to care, but you want access to the best care. Since the program launched in 2023, pharmacists have provided 1.8 million assessments. Meanwhile, 2.5 million Ontarians remain without a family doctor. For City News, I'm Tina Yazdani.